How are cheek dimples created with cosmetic surgery?
The influence of celebrities and social media has made having dimples a growing area of interest. For many of our patients, they express how much they envied siblings who had dimples and got a lot of attention because of possessing them. It's remarkable how passionately people come to our practice for dimple creation surgery, also known as dimpleplasty. This procedure has been increasing in popularity, and we are seeing more people coming from around the country and world to have this done. I'll discuss how I approach dimple surgery in my practice. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Dimpleplasty is an interesting niche we've become well known for, and we've been featured in the media for this procedure. During a consultation for dimpleplasty, I ask the patient questions such as why they want to have dimples and what is it about dimples that they think are good or desirable. After reviewing relevant medical history and current medications, I begin the consultation by showing the patient where a dimple would have naturally occurred if they had been born with them. Very often, people think dimples are much higher in the cheeks than they really are when someone is born with them. There's a particular area in the cheek that I refer to as the sweet spot, where the anatomy would allow for a dimple to be formed. I show them where this sweet spot is, I mark the area, I have them then use Q-tips to push in those areas. Pictures are then taken with them smiling so they have an idea of what the final results will look like. The goal of dimple surgery is to create a natural appearance of a connection of a muscle between the buccinator muscle and the skin so that when you smile, you get this nice, natural-looking dimple. Dimpleplasty may seem like a straightforward procedure, but in fact there are many elements that are deceptively complex and can make it a less than predictable procedure than a lot of other cosmetic procedures. When we create dimples surgically, we're creating a connection through the inside of the mouth between the buccinator muscle and the skin of the cheek. As the muscle contracts when smiling, the cheek pulls in and you get this nice dimple shape. There are a few different techniques to get this done, and I've developed a variation of a technique which has yielded a consistently high rate of success. Some variables that can affect outcome include the relative thickness of the skin, the amount of fat under the skin, the elasticity of the skin, and the resilience of this muscle-to-skin connection after suture placement. Some technical challenges that make this procedure not so straightforward are people who have thicker skin and people who have a lot of fat in the cheeks, and they tend to have a harder time getting a really good deep dimple. There's also the chance that the dimple will not be as deep as you like or not have the shape that you would like. There's a limit of what can be done, and there are times when enhancement or revision is necessary, like any other cosmetic surgical procedure. It's important to understand that initially you can expect that the dimples will be present even when you're not smiling. It's also common to have different degrees of dimple depth for the first several months. This is because we want to make that connection between the muscle and the skin sufficiently secure so the dimple will be present long term. Interestingly, most of our patients have no problem with the indentation that's temporarily always visible and have reported back to us that its presence was not a problem in social situations. As far as aftercare is concerned, I tell my patients that since we're working in the inside of the mouth, basic precautions to keep the mouth clean is advised. We routinely place our patients on antibiotics and have them use antibacterial mouthwash. We also give them specific restrictions regarding different types of food they can have, as well as the proper temperature the food should be in order to allow the opening inside the mouth to heal adequately and minimize the risk of infection. Generally speaking, patients can go back to work the following day after dimple surgery. Since the procedure is done completely on the inside of the mouth, there's usually no external incision and no stitches or anything on the outside, just the indentation of the dimple. Over the course of several months, the dimple tends to soften to the point where it appears more pronounced when smiling. There can be a subtle or not so subtle indentation in the cheek at rest, which is often seen in people who have natural dimples. If you've been considering dimpleplasty, meet with a doctor who is highly experienced in performing dimple surgery. I always say that this procedure is deceptively complicated because you're working in a very small area to create a very specific result. I've been referred patients for dimple surgery from doctors who are in positions such as chief of plastic surgery at a major hospital. It's a niche procedure that doesn't have anything to do with being a better surgeon. It's a matter of experience which comes from performing this type of surgery regularly. Many acclaimed surgeons simply don't perform dimpleplasty with enough frequency to be comfortable in performing this procedure. Surgically created dimples can be affected by facial fat and weight changes, so maintaining a healthy weight and living a fitness-focused lifestyle is beneficial. Surgically created dimples can last a long time and give you the added impact to your smile you've always wanted. I hope you found this information helpful. Thank you for your question.